tell Tim when to start, okay? It's one.
So I'm Tim Brewer. I'm the chairman of the board of directors of the Consortium of Universities for Global Health. And good morning, good afternoon, or good evening, depending on which time zone you're in. On behalf of Keith Martin, our executive director, I'm delighted to welcome you to this webinar where today what we're going to do is share with you some information about CUGH and give you a chance to ask Keith and myself any questions you may have about the organization, what it is we try to do, and together with you what we hope to accomplish to improve health around the globe. Keith, did you want to say a quick hello?
Well, thanks, Tim, and thanks very much for joining this webinar, part of a series of webinars that we're running here at CUGH. And what Tim said is he'll do the first half of this, introducing part of what we do with you in global health, and I'll do the last half about CUGH, and then we will get into a question and answer. So please prepare your questions, and at the end, what we'll do is answer your questions and have a good dialogue going back and forth as to how we can hear from you in terms of how CUGH can better respond to your needs and address the global health challenges we face. Tim, over to you.
Thank you, Keith. So we'll try to move through this part fairly quickly so that there's plenty of time for questions at the end. So what you're seeing now is the CUGH mission statement, which is to build interdisciplinary collaborations. And fundamentally, what we try to do as an organization is to try to help universities, individuals, and other organizations work together to solve global health problems. And I think the key message from the mission statement is really that interdisciplinary. What we've recognized, being based primarily at universities, is that there's really a range of expertise and experience across the spectrum of what universities do, both disciplines, so that's health sciences, law, management, humanities, arts, and culture, and across not only the disciplines themselves, but also bringing all those individuals together to work together. So that's really the goal of CUGH, is how do we get colleagues who bring different perspectives and experiences to come together both nationally and internationally to solve common problems. Because as we understand in global health, these are not issues of just international countries. If you're based in the United States, these are issues that we directly affect here as well. So Ambassador Birx, the Global AIDS Coordinator, was at UCLA yesterday, and we were talking about actually some of the issues in South LA, which are directly relevant and comparable to some of the challenges of working in sub-Saharan countries. So really global health does encompass that local global component. As you can see from this slide, CUGH was formed in 2008, initially with some funding from the Bill and Melinda Gates and the Rockefeller Foundations. We started out with a meeting in Bethesda and have since grown to an organization that has approximately 150 members, institutional members, across spanning about 60 countries if you include all the people who attend our conference. In 2012, we opened our secretariat in Washington, D.C. We're delighted to have Keith as our founding executive director, and we also have on the webinar Dalal Najjar and Karen Lamb, two critical members of the secretariat that help us to get all the things that we do done. We've had conferences in Seattle, Montreal, D.C., and Keith will talk about some of the upcoming conferences later in the presentation. May I have the next slide, please, Karen? So what you see here is the board of directors for CUGH. It includes both U.S.-based, European-based, and African-based members. We have one member from Asia, Sri Lanka as well. So a nice diversity in terms of representation. And that's one of the goals that we've been working on in CUGH, is really to broaden out our institutional membership beyond North America, where we initially started. May I have the next slide, please, Karen? These are the officers of CUGH. So I currently serve as the chair. My term will expire in April with the CUGH meeting. Whoop, we'll go back one. Thank you. Pierre Bukins, who's the Dean of Tulane School of Public Health, will become the chair after having served a 2-year term as vice chair. Ann Kurth, who's actually now the Dean of the School of Nursing at Yale University, will become the vice chair. And Peggy Bentley at the University of North Carolina will be joining the executive committee in April as the new secretary-treasurer. Judy Wasser-Hyde at the University of Washington will be rotating off, and I'll assume the position of past chair. Next slide, please. So what I'd like to do now is shift gears a little bit and talk about some of the products and services CUGH is working on to try and help members build global health capacity, both within their own institutions and with their partners. And one of the new events that we undertook actually was held in January of this last month, where we brought together the program directors for the graduate programs. So these are master's and PhD programs in global health, and started a conversation about what are the challenges of developing new graduate programs in an emerging field. And I think this just highlights one of the benefits of CUGH, which is to serve as a convener and a facilitator. So one of the things we can do is help to identify people at universities and other organizations grappling with the same challenges, whether those are educational challenges or their program challenges, bring them together and create a forum where they can exchange ideas about how they can make their programs better. And I think that's a real terrific role for CUGH to play. May I have the next slide, please? So we have a series of standing committees, and these committees are the mechanism by which CUGH undertakes some of its activities. The oldest committee is actually our education committee, and I want to take a step back to briefly mention the Global Health Education Consortium, or GHEC, because GHEC is a critical part of what is now CUGH. And around approximately 2010, 2011, the board of CUGH and the board of GHEC began having a series of discussions, recognizing that there was probably value in coming together. And that merger was completed around approximately 2012. And out of that really came the genesis of the Education Committee, which has remained our most active committee of all the CUGH committees. And really their goal is to create resources and support for member institutions in particular around developing their capacity to train the next generation of global health leaders. Our current chair is Sam Mahaney at the University of Kentucky, and Dr. Tom Hall at the University of California, San Francisco provides incredible intellectual support for that group. May I please have the next slide? Among the activities that the Education Committee is undertaking, one is they're working on looking at core competencies for global health. Both are there core competencies that run across all disciplines. So, for example, if you're training in global health and your basis is in humanities, are there core competencies that exist there that also apply if you're training in, say, nursing or the health sciences? So that's one very important activity Jessica Everett is now in charge of that. Linda Wilson at the University of Alabama, Birmingham has been an incredible contributor to that effort. A second group focuses on developing educational content for the conference. Anvar Belgi is leading that effort for us at California North State University. And then a third group is looking at developing actual resources and modules that would be available to CUGH members to use. May I have the next slide, please? We also have a mentorship program. So for the past year, I've actually served as a mentor for another CUGH Global Health program. This is a terrific program where we pair an emerging global health program at a university with a colleague at a more established global health program so that the individual who's earlier on in developing their program within their university as someone they can bounce questions and ideas off of. We do site visits, so I actually had the opportunity to go visit my mentee's program for 2 days to meet with the provost, with the dean of the medical school. Really a terrific chance for me to get to understand the constraints and opportunities of their programs, and then try to give them some of the benefit of the experience I had setting up a global health program about 12 years ago. And so this program now serves about 20 mentor-mentee pairs, and we're hoping to continue to expand that. We're also trying to understand where do global health graduates go when they finish their training, and we have a workforce group that's trying to understand what are the skill sets and knowledge that potential employers are looking for. And the next slide, please. Our finance committee looks at where the money comes from and how we put it out. It's chaired by our secretary-treasurer, who at the moment is Ann Kurth. The primary source of revenues for CUGH is the institutional membership fees, to a lesser extent the individual membership fees as well, and then we do generate some money from the annual conference that also feeds into our programs. So those are the main sources of revenue. We do occasionally write grants. Those grants tend to be project specific and often relate around activities related to the conference, such as supporting participants from low and middle income countries to participate in the conference. May I have the next slide, please? And of course, at the end of the presentation, we'll open this all up for questions, and feel free to ask questions about any of these committees or their activities. The research committee is chaired by Peggy Bentley at the University of North Carolina, and really what they're focusing on is trying to help our partners, both domestically and internationally, to build their research capacity. So they do that through a series of different ways, similar to what the Education Committee does in terms of developing resources. One of the things that we're putting in place this year we're very excited about is a Speakers Bureau program, so that if you're looking for experts to come to your university or organization to talk about particular topics, then the Research Committee can help to identify that. The committee also supports abstract submissions by trainees to the conference. We have an awards program to recognize the best research abstracts, and we have a wonderful partnership now with USAID around getting some of those published. We also publish the abstracts in the Lancet Global Health and the Annals of Global Health as well. And my lights have just gone out because my motion detector is on. So anyway, we'll move on to the next slide. So at this point, I'd like to turn things over to Keith. Keith, please.
Thank you, Tim. And we'll finish the last part of this in the other part of CUGH that we have not spoken about. And as Tim mentioned, we have a series of committees. It's a mechanism for us to empower and engage our members. And the next committee I'd like to talk about is the Enabling Systems Committee. And this committee really deals with the administration of global health programs. We have a wonderful leadership with King Holmes and Ann Anderson from the University of Washington. Karen Lamb does the administrative work to support it. And this particular group provides workshops, webinars, and symposia on issues relating to the administration of global health. One of our last webinar we had just a couple of weeks ago, we worked with Massachusetts General Hospital to talk about the issues you face when you have an emergency abroad, if your faculty and students are abroad. It was very well attended. We had about 380 people from around the world. And we brought in experts from the field in Uganda, 2 individuals there, along with 2 individuals in North America to provide that workshop, to provide that webinar. And we will be having other webinars on enabling systems in the future. And we would like to hear your ideas on what webinars we should be having. But so stay tuned to our information that we'll be providing to you about these webinars. We also have a listserv that our Enabling Systems Committee has, and so we invite your participation on that listserv, and it's a chance for members to be able to share good practices, new ideas, and challenges that they may have. Karen, could I have the next slide, please? So part of our constituency, of course, are students. And what we're committed to doing is to finding ways in which we can engage students and student networks in what we are doing. And our Student Advisory Committee, made up of individuals from various institutions, come together to deal with a number of issues affecting students themselves, such as student debt, global health issues that they're interested in working on, and they're also connecting other networks, other student networks in the world to be able to come together, work together, and mobilize together to be able to deal with challenges that they face. And this is also a mechanism for students to engage in our larger global health community so we can work with them to address these challenges. So Jessica Ebert at CFHI, Child and Families Health International, has been doing a marvelous job as the liaison for that. And Eleazar Gutierrez is our education assistant who works here at the offices in Washington with all of the education committees and its subcommittees to provide the administrative support they have. And I have to say that to thank Dr. Tom Hall very much for the support he has given to the Education Committee in supporting Eleazar's position. Can I have the next slide, please, Karen? Advocacy and communications is a very important issue for you, and it's important for us. And CUGH is a conduit to enable us to hear what your advocacy issues are, to share to our communications networks issues important to you, and to mobilize the larger global health community to support those issues. And we do this in various ways. We have social networking, and so our Twitter handle, we'd sure like for everybody on this call to please share our Twitter handle at CUGH News, and the student trainee Twitter handle that exists, and that's CUGH lowercase TAC, CUGH lowercase TAC. Sign up and share that, because this is an important mechanism for us to share what we're doing and what you're doing in global health. We also have a monthly bulletin that Amy Kasman, our administration assistant here in the office, provides. And in that bulletin, we share information about you and for you. We also feature specific members every month. In fact, recently we have featured University of Maryland, Baltimore, as well as the London School of Hygiene and Tropical Medicine, as well as many others. And we'll be featuring you if you provide us with a little information about your institutions. We're happy to share this globally. It's also a mechanism for us to advocate, as I mentioned before, for our members' needs. And we're engaging with the government relations reps from various institutions to learn what their needs are so we can mobilize around supporting their issues. Big global health challenges are issues we have pursued, such as issues on funding for research, the Ebola outbreak, gun violence. We've also worked with the ASTMH on fake drugs, a huge global health challenge. And so your ideas on how we can be supportive of your issues, please let us know. I should also say that not only do we have academic institutions as members, but we also have groups like the American Cancer Society. And today being World Cancer Day, we're putting out information about what you and others can do to be able to address this global scourge. I'm the chair of that committee, and Amy helps on the administration and supports the administration of the committee. Karen, may I have the next slide, please? So the membership committee, which is chaired by Dr. Richard Deckelbaum at Columbia University and Dr. Mohammed Zaman from Boston University, this group provides us with strategic advice on how we can grow our membership. Over the last 3 years, our membership, in fact, has almost tripled in size, and this has been something very encouraging for us to see. Generally, the structures of membership fall under two broad categories. One category is the issue of institutions, and the other one are individual members. So if you're not a member of a CUGH institution, and you can find out whether you are or are not on our website, CUGH.org. If you're not a member, please join and become an individual member and enjoy the benefits that I'll speak about in a little while. We also have a tiered mechanism for payment. So if you're in a high-income country, upper middle, low middle, and low-income country, your fees will actually decline accordingly. And we also have a separate category for students, which is substantially less than that for individuals that are not students. So take a look at our website, and you'll be able to see how to join, and we encourage you to do so. If your institution's not a member, please join, and if you're an individual member who would like to join, please do so. One important part on membership is if your institution is a member, then every single faculty person, student, and administrator is also a member of CUGH and will enjoy the benefits that membership provides. So please share that knowledge across your institutions if you are a member. Can I have the next slide, please? So these are the membership benefits, and I won't go through all of those, but I will say that being a member of CUGH enables you to have access to our opportunities board, discounts for our Global Health Conference, webinars, workshops that we have when we charge them, and access to a large network internationally of global health leaders and more than 12,000 individuals who are also part of the CUGH network. Can I have the next slide, please, Karen? So one of our major activities that we do is, of course, our annual conference that Tim referenced. So our conference this year is coming up in April 8th to the 11th in San Francisco. And you see the beautiful banner that's down there. You'll find that on our website. So please click on the website, and you'll find information about the conference and how to sign up. And I'd encourage you to join and register soon because of the discount rate that applies just for the next couple of weeks. Future conferences are planned for Washington, D.C. in 2017, and in 2018 we will have it in New York City. Next slide, please, Karen. This conference that we're having in April in San Francisco will have a special focus on governance, the MDGs, Sustainable Development Goals, but the overarching theme of the conference deals with the compelling challenge that you and I know very well, is how do we enable us to be able to improve human health and also health of the planet, both being inextricably linked to each other. So in fact, that's the theme of the conference. This is global health sustainability. And we have a fabulous roster of events and speakers coming to talk about planetary health, One Health, EcoHealth, and how they'll be able to share some of the good practices that are taking place and some of the opportunities and challenges in the future. We'll also be featuring speakers from the Rockefeller Foundation Lancet Commission report that just came out last year on planetary health. So we really encourage you to join and come in and listen to this very important conference on issues that are vibrant and pertinent to today and into the future. Next slide, please, Karen. that you can see the featured speakers, and I won't dwell on them because sensitive to the time we have, but please take a look at our website. Karen's done a very good job of outlining the speakers that we have there. More will be coming in the future. Next slide, please, Karen. And we have a whole series of satellite sessions, and they'll be taking place not only on April 8th, but also at the end of the conference. And a couple I'd like to point out to you because they really relate to important relationships that we have forged with big organizations. So CRDF Global will be running a session on partnerships as they relate to global health security. And now for the 4th year in a row, we were delighted to say that we're going to have an entire day on global health cancer with the National Cancer Institute. That's been an ongoing and reoccurring theme, and it grows every year. So that's, of all the sessions we're having on the 8th of April, that's the only one that will be charged a modest fee by NCI. The rest are free, but you have to sign up for them. We'll also be having important sessions with our education committee, with the Global Health Fellows Program, University of Maryland, and we're having a special session on the Zika virus that our research chair, Peggy Bentley, is working with John Paff and the team at the University of Wisconsin. So please sign up, and if you're coming to the conference, make sure you do not miss April the 8th. I should also say that our students at our trainee advisory committee have been working with the University of California students to run an entire day for and by students. This is the University of California annual Global Health Day, and that's also going to be taking place on April the 8th. So if you're a student, please sign up and come to that. Next slide, please, Karen. So in short, our activities run across a broad range of options for members and non-members. We have a very exciting workshop that our Director of Operations, Jalal Najjar, has been working on very hard. And it's the top one, Understanding and Transitioning to the new USAID, NIH, and CDC rules and compliance for finance and compliance rules and regulations. That's taking place here on February 29th to March 1st in Washington, D.C. And on March 1st in the evening, we're going to have a get-together, so everybody's welcome to attend that. But you have to sign up for that because space is limited. And I would encourage you to do so because the space is filling up. But this particular workshop is going to be very interesting and important to any institution that has an engagement and involvement with those 3 important funders. So please sign up and come to it if you can, and please share this information to those across your institution and to your networks, because the new rules and regulations are very important for you to know in dealing with CDC, USAID, and NIH. We have an upcoming webinar taking place on next week on February 10th, and it's on global health competencies that our Global Health Subcommittee is working on, and Jessica Ebert is leading that effort. We also have a number of listservs that you'll see below, and you can access those on our website. Karen, may I have the next slide, please? And one of the things we're trying to do, of course, is in our collaboration with our colleagues in low-income countries, is how can we deal with the pressing challenge of capacity building. And given that CUGH has a very rich and large number of institutions and capabilities, one of the things we're doing is finding ways in which we can facilitate collaborations and partnerships, long-term partnerships, that can help to deal with building up the education and training capabilities of institutions in low-resource settings. So we're very excited about this. We've had some very good responses, and Tim and I and others were working with the CDC and other organizations to facilitate this. The Minority Serving Institution initiative deals with the compelling challenge of how do we enable our colleagues in minority serving institutions to have the same opportunities in global health as others do. And we're extremely grateful to Sharon Rudy, Dr. Sharon Rudy, and the team at the Global Health Fellows Program, too, for their work and support for our engagement with minority serving institutions. So we're pulling together a group of MSIs to work together with us to be able to work through the obstacles that they face and help to strengthen their global health programs so that their faculty and students can have the opportunities that others have enjoyed. Next slide, please, Karen. So that tells you, that's our second to last slide. It tells you how to join CUGH. I'm dwell on it, but I would reference and ask you to take a look at our website at cugh.org and please join, because we're only as good as you, our members, and in global health is such a large challenge. And for us to be able to deal with these challenges, we have to work together. And we will only be as good in our ability to do that as if we are able to expand our networks, learn from each other, and share some of the best practices and innovations that you're creating. So please join. Please look at our website, sign up for our newsletter and bulletin, and keep informed about what we're doing, and we'll work together to deal with the challenges we face. Next slide, Karen. So that's us, and we thank you very much for joining us on this website. And now we invite you to please send us your questions, and Tim and I will do our best to respond to them. And again, thank you so much for joining us on our webinar.
Thank you very much, Keith. There are 3 questions I've received so far. I'll just try to knock them off quickly. The first is, how many attendees do we expect at the annual conference? The second is, can I share a little more about the mentorship program and opportunities to participate? And the third is, what are some of the new activities and goals for CUGH in the coming year? And Keith, feel free to jump into these as well. So we get about 1,600 individuals from approximately 60 countries attending our annual conference. It comes from across a range of faculty, students, government officials, NGOs, really a nice mix of people working in global health. And that's been fairly consistent for the last 3 or 4 conferences about that. So we would expect that to be similar moving forward. Approximately 60% of the attendees will be faculty or outside of universities, and about 40% will be trainees. To give you a rough sense of the breakdown, about 85% will be from North America, and about 15% will be from other countries. In terms of the mentorship program, the best thing to do would be to write CUGH at info@cugh.org, and they can connect you with John Ripp. John Ripp at Mount Sinai is actually the head of the mentorship program, which is run through the Education Committee. I know that we just completed our first year, and we're undertaking an evaluation, but the initial feedback has been very positive, and we will likely be rolling out a new program this year, and we're looking for both mentors or mentees. So if you're interested in either serving as a mentor or you're interested in partnering with a mentor, please write to us at CUGH, and we can get you in touch with Jonathan and the group and make sure you're part of that. It's a really exciting program, and I think I learned as much being a mentor as I may have provided to my mentee. I think Keith touched on some of the goals and activities for 2016. I'll just elaborate by saying one area that we're looking at actively is we're bringing together university programs that actually run global health minors and majors for undergraduates, and we're starting to do at the undergraduate level what we're doing at the graduate level, which is bring programs together and understand how they might share resources, whether those are educational or ideas about applications. Another area that we're looking at in the future is developing a common application, probably starting initially for graduate programs, masters, and doctorates. So these are some areas that we're looking at. One that Keith did mention, I'll just expand on a little bit, is partnering with the CDC to help facilitate the engagement of U.S.-based academic institutions with internationally based institutions. And I think this is going to be a real exciting area for us. Keith, I don't know if you wanted to add anything to those?
Well, just thanks, Tim. As we know, global health tends to be quite dominated by those of us who are in medicine. And we also know that we in medicine cannot address the problems in global health alone, and that those with non-medical skill sets are as vital and perhaps more vitally important to addressing these global health challenges. One of the challenges we have is to be able to include within our academic members those areas and disciplines that are not medicine. So engineering, social sciences, the broad architecture, planning, and others are critically important for us to be able to work in global health. So please, if you're in any non-medical discipline and you're in an academic institution working on global challenges, please sign up and join our bulletin, join our individual network, because you're a member, if your institution's a member, so we can work with you and tap into your expertise. And also our colleagues in low to middle income countries, as Tim referenced, we have expanded our involvement with our colleagues overseas, but we need to do more. We want to do more. We have a good collaboration with Canada through the Canadian Consortium of Global Health Research, but we really want to also expand significantly internationally. So if you're listening to this and you're from a country outside North America, please consider joining CUGH. We need to work with you.
Okay, so we have a couple more questions. Terrific. Please keep them coming, and we'll try to keep our answers short so we can get to as many of these as we can. So the next question is, do you have advisory activities or meetings to support the exchange of undergraduate programs similar to what we're doing in global health? So this is a new area for us, and there will be a meeting at the annual conference in San Francisco in April. Paul Drain at the University of Washington is helping to organize it for us, where we're hoping to bring undergraduate educators together for the first time. So this is relatively new for us, but the goal is, yes, to create a resource similar to what we're building for the graduate programs at the undergraduate level, where if you're involved in undergraduate teaching, and I can tell at UCLA we just rolled out an undergraduate minor this past year, and it's been immensely popular. So if you're involved in those activities, yes, we are trying to create a forum and a place where you can engage with your counterparts at other universities and share resources. Another question is, what strategies is CUGH using to expand participation by global health professionals beyond medicine? Keith, did you want to, since you started to talk about that, did you want to expand on that a little bit?
Thanks, Tim. So what we're doing is, at every chance we have, we are capturing work that's being done in non-medical disciplines and sharing that. We are actively pursuing different professional associations, such as engineers. We have not only academic members as institutions as members, we also have other groups, NGOs, associations. An important association, for example, is the American Association of Veterinary Medical Colleges. That's a member of ours, who's bringing in the veterinary community into what we're doing. We also like to bring in other sectors, the private sector, NGOs, large non-academic institutions like the Center for Strategic and International Studies that's partnered with some of our members on doing various studies. DevEx is a collaborator with us, and so if you're a DevEx member, you actually get a 20% discount for joining. So we're trying to go through different associations, organizations, and sectors to be able to include non-medical disciplines in what we're doing, and we feature your work in our work.
I think I'll just also add to that, thank you, Keith, that we're doing this at all levels. So on our board of directors, we have an engineer, we have a sociologist, we have an anthropologist, In addition to physicians, nurses, and some of the traditional health sciences, we have two vets on our board of directors. So we really are trying to expand beyond particularly the health sciences, because we recognize, as does the World Health Organization and others, the critical role that social determinants, the economy, the environment, all play in making for a healthy society and a healthy individual. And to do that, we've got to bring that expertise in. But it is a challenge for us. So we have another question just to branch off on the environment a little bit, and I think this is an exciting area for CUGH. As you're probably aware, the Lancet published a Lancet Commission on Planetary Health, and Richard Horton, the editor of the Lancet, will be discussing this at the conference in April. In addition, we'll have a plenary panel that includes 4 of the commissioners of that commission discussing the report and how we might be thinking about ecosystems and the environment and their relationship to health. We're also having a panel session in the conference on urban health, and it's going to focus on things like how do you design cities in ways to make them actually healthier and to promote health, to try and broaden the perspective a little bit about how we think about health interventions. Keith, I don't know if you wanted to add anything to that?
Just to say, there's a couple of questions that I've got here, Tim. Catherine asked about archiving past webinars. Yes, Catherine, we do archive them, so please look at our website and they will be up. And I know you asked specifically about the one we did with Massachusetts General Hospital. That and all of these are going to be up. And the other questions about joining and participating in the education committee and its subcommittees and contributing to it, as I said, they have a listserv. But please contact Eleazar, who is our education assistant, his email, or look on our website and you'll find ways to join under the committee section.
So I think just to keep it simple, anything you said to info@cugh.org will work to get routed to the right place. So if you can remember the specific names, terrific, but don't worry. If you could just get it to info@cugh.org, the very talented Secretariat staff will make sure that you get hooked up with the right group or committee. So I have a couple more questions. Keith, did you have any that you wanted to bring up at this point?
You go ahead, Tim, and I'll do mine after yours. Go ahead.
Okay. So in what ways can CUGH provide grant writing support or facilitate collaborations to write grants for institutions in low resource settings that lack such capacity? So from Quentin, hi Quentin, how are you? And glad you're on. Quentin is actually leading our workforce group, and that I mentioned about talking about understanding what are the opportunities where people have jobs after they finish their global health training. So terrific question. So we actually don't have a lot of internal capacity right now for that. We do have a secretariat of 5 people, including the executive director, that manages all of our activities, including providing support for the committees and the resource groups, as well as the conference, which understandably consumes a big amount of their time. But I think what we can do is we can facilitate partnering between members where that capacity exists. So a number of our own universities have that internal capacity, and we work with our partners internationally to help support their grants and writing their grants. This is particularly a big issue moving forward as federal funding, for example, PEPFAR, is shifting from funding U.S. institutions to internationally based institutions, and we're going to be subcontractors rather than the primary grant holders. So working to build that capacity with our partners is very important, and I think what CUGH could do is if your own university does not have that capacity, similar to our mentorship program, we could try to link you with another colleague at another CUGH membership that might be able to help you develop that capacity. Keith, why don't I let you grab a question?
Yep. And that could be a part of our mentorship program that we have in terms of mentoring, and Quentin and I have discussed in the past, finding ways, and Tim referenced, finding ways in which we can link up those who need grant writing assistance and mentorship to those who know how to do that and have experience in that area. One of the areas was asked on the questions in terms of finding out more information about upcoming events. Again, if you sign up for our Twitter account, handle it @CUGH News, we will send all this information out regularly. And again, if you go on our website and look at our bulletins and sign up for that, which you can, you'll also get information about our activities and also about the activities of your colleagues in other institutions around the world. And also important global health opportunities, funding opportunities, jobs, grants, competitions. They're all on our website. They're on our website, but they're also on our bulletin that you'll receive at least every month. So I would encourage you to join that and sign up for it. Tim?
So I have a question, Keith, from Ben that asks, in what ways does CUGH support or plan to support members, especially students, who wish to work in low and middle income countries? And does CUGH advocate at universities to support this? So Ben, we're trying to address this through a couple of different ways. One way is that previously with GHEC, and then together when GHEC and CUGH merged, we've been very active in developing pre-departure training guidelines to recommend for universities who send their students to work in health situations internationally. And we've also worked with accrediting bodies to try to get in place some basic standards for what kind of training you should have before you work internationally. The Competencies Committee is expanding on their work to specifically address this issue of what competencies do you need to have if you're going to work in a low-resource setting internationally, and do those differ from working in a low-resource setting in your own country and in your own setting? So that's a very important area where we're trying to figure out the global-local connect and trying to understand how does the training need to be adapted depending on where you actually physically need to be. Supervision of trainees is another area where we're working with our member institutions to try to figure out how do we make sure that the supervision is in place. And then Keith touched on the webinar, for example, around enabling systems is what do you do and what systems do you need to have in place when things go wrong, as one example. So I think we're trying to address it from a number of different areas. I think an exciting potential future project that Keith briefly touched on was partnering with the U.S. Centers for Disease Control and Prevention to try to identify potential partners in low and middle income countries who would be willing to engage with our North American-based institutional members. So that's something we're still in the exploratory stage, we haven't rolled out, but I think this could be a very exciting benefit of CUGH membership moving forward. Did you want to add anything to that, Keith?
Just to say that just to reiterate again the importance of non-medical disciplines being involved in this, because as we know, if we're going to work with our colleagues in capacity building, we need both those medical skills and non-medical skills. And also our education committee really does a fabulous job of attracting and identifying curricula. So if you have a curricula that you think would be useful, please share it through our education committee. As Tim mentioned, if you go info@cugh.org, we'll get it to the right place. But please share your context-relevant curricula across medical and non-medical disciplines. I just a question here from Joan. Joan says that she's a recent residency graduate and doesn't know anybody personally involved in global health, but she'd like to be engaged. She'd like to know how to get in contact with others. Joan, please again sign up for our information, join our network. You'll get information about what we're doing. But also, if you look at our membership tab on our website, then you'll find institutions that may be close to you. Also, join individually, because that gives you the benefits of joining and the discounts to our various activities.
And I would just add, come to the annual conference. It's just a terrific way to meet like-minded individuals from all around the world interested in global health and learn about what they're doing. So I want to get to a question from Marjorie about strategies that CUGH is using to expand participation by global health professionals beyond medicine. And this is a challenge, I think, for all of us engaged in global health. So we try to do this a couple of different ways. One is we try to make sure that our leadership is diverse. And so as I mentioned, we have a number of non-health professionals on our CUGH board. A second way that we try to address this is through the actual conference. And so we're focusing in San Francisco on sustainability. We'll be talking about the environment, and we'll actually have evolutionary scientists presenting. The urban health panel that I mentioned includes the mayor of the city of Cali, Colombia. We have a professor of urban planning from UCLA talking about how do you design cities in ways that are promote health. Things like sidewalks, parks turn out to be critically important for getting people to be more active. There's a Shark Tank Innovation Symposium that will be held at the conference being run by engineers. So it is a challenge to push beyond the health sciences, but we recognize that it's essential, and we're trying to do it both through the information and presentations that we highlight in the conference, which is our largest program, and through the actual organization of CUGH itself by having non-health sciences involved in all our committees up to and including the board of directors.
And Tim, I just want to add, if I may, a couple of things, folks, that you may want to know about. We have a very important relationship with the Pulitzer Center for Crisis Reporting. We run a global health film festival at our conference every year, and we'll have one again in April. We're also running a video competition with them. So if you have short 5-minute videos on innovations or on advocacy issues in global health, please send them to us as soon as possible, within the next week if you can, to be able to compete for this. Because then your videos are going to be shown and shared throughout our networks, and we'll be keeping them online. We're also running a communications workshop with the Pulitzer Center. They've agreed to do this again after the successful one we had in Boston at our conference last year, and that'll be on day 3 of the conference on April the 11th. So please come out and sign up and join that too. Tim?
Thank you, Keith. So I have a question from Absera. Can you describe your eligibility requirements for the Global Health Mentorship Program, both for the mentor and the mentee? Terrific question. Probably best directed to John Ripp and the subcommittee, but I can give you a sense. So the original mentors were individuals who had been running global health programs for at least 5 years. And that wasn't a formal requirement, it just how it happened to turn out. And the mentees, to be quite honest, were anyone who wanted to be mentored. And we had about 12 to 15 primarily individuals who were either initiating global health programs within their universities or had recently initiated global health programs. So the mentor-mentee relationship has primarily been between individuals who are actually responsible for running the programs within their universities, but it doesn't need it to be limited to that. So for example, hopefully what will come out of the program directors meeting is that we have mentee pairs between people who are running master's programs in global health or doctoral programs. It'll be very interesting to see what comes of the meeting for undergraduate programs during the San Francisco conference. And so I can envision a variety of different type of mentor-mentee relationships that CUGH could help to facilitate, though at least in the initial round, it tended to focus on programs that did do both education, research, and capacity building, and really trying to understand such questions as, how do you get your university to support this? How do you get faculty to be able to work together across different schools, because they're often based in different schools? How do you facilitate teaching of classes when you're pulling in faculty from different schools? Are there pre-made resources available for certain types of content that mentees can use to launch their curricula if they don't have the internal capacity to build out a whole curriculum by themselves? So those are some of the activities that were involved. Keith, I don't know, did you want to add anything?
But just I've got a question here. It's actually a statement just to remind us of a collaboration we have with the American Association of Medical Colleges. It's their GLOW collaboration that deals with medical students who are going abroad. It's a fabulous initiative to look at and participate in. And on the partnership I didn't mention, which is important, is our partnership with the Gairdner Foundation. And just to give a sense of the quality of speakers that we have at our conference, the Gairdner awardee and speaker that we had 2 years ago at our Global Health Conference in D.C., Dr. Satoshi Omura, won the Nobel Prize for Medicine last year. So we get some very good speakers coming, and we, as Tim mentioned, we really encourage you to come out to the conference. It's a fun time, it's a fascinating time, and we have a lot of new initiatives and programs that I think you'll find very enjoyable to participate in and meet your colleagues. Tim, I think we've got time for another short closing comments, and did you want to conclude with a couple of points?
So I just want to thank you, Keith. I just wanted to thank everyone for participating in the webinar, and please view this as the start of a discussion. Please contact us at CUGH.org. You can also write me directly. I believe my email is on the CUGH website, but if not, it's tbrewer at conet.ucla.edu, tbrewer at conet.ucla.edu. Let us know how we can make CUGH better to meet your needs. Help us to help you and your partners to build your global health programs and to address health equity. This is fundamentally about the members, and as Keith mentioned at the beginning, we're only as successful as being able to help you do the very important work that you do. So with that, I'll turn it over to Keith to say a final goodbye, and thank you again very much for joining us.
Well, thanks, Tim, and I'd like to thank you for taking the time out of your very busy schedule at UCLA as the Vice Provost to do this webinar with us. And I'd like to also thank Karen Lamb here in the office, who's done a fantastic job putting this together, and Dalal Najjar for all of her work that she does as our Director of Operations. And Amy Kasman does the administrative work, as well as Elazar Gutierrez, who as our Education Assistant. And I want to thank you, as Tim mentioned. We're only as good as how we're able to work together, our collaborations, and I want to thank you for your support of CUGH through the years. And we look forward to working with you as we expand and grow and are able to address the challenges before us. It's an exciting time to be in global health, and we look forward to working with you now in the future and hope to see you in April in San Francisco. Bye for now.
Have a great morning or afternoon.